Hi, my name is Dr. Susann Clothier. I'm a chiropractor of performance spine and sports medicine, and today we're going to talk a little bit about Graston technique. Graston technique is an advanced form of instrument-assisted soft tissue mobilization, which enables clinicians to effectively break down scar tissue and fascial restrictions. The technique is performed with patented stainless steel instruments and designed to effectively detect and treat areas exhibiting soft tissue fibrosis. So these are examples of all the tools I use here. There's 6 different tools. So the GT instruments detect and amplify soft tissue restrictions similar to how a stethoscope would amplify the sound of the heartbeat. All the instruments have contoured edges designed to conform to a different body surface and conformation. There is a concave, convex, rounded, and pointed edges. The treatment edges are also single beveled, which means you treat in one direction, or double beveled, where you can treat in both directions. So the benefits of this technique are quicker, improved outcomes. You can focus on the patient's participation, allowing the patient to feel more control of their treatment, and also managing their diagnosis and rehab process. Its focus on education enhances patient independence by learning more about their diagnosis and their rehab process, and helps improve the quality of life. So diagnostic indications for Graston technique is indicated for virtually any patient who would benefit from a soft tissue mobilization. After evaluation, soft tissue mobilization is used to release and lengthen tight, shortened, restricted tissue with the goal of restoring musculoskeletal balance and normalizing movement and posture. So clinical indications for Graston technique would be tendinopathies such as medial or lateral epicondylitis, Achilles tendonitis, de Quervain syndrome, patellar tendonitis, some fascial syndromes such as plantar fasciitis, IT band syndrome, compartment syndrome, trigger finger, also myofascial pain and restrictions, chronic and acute sprains and strains, reflex sympathetic dystrophy, neck and back pain, and rotator cuff tendonitis. So some other clinical indications would be any kind of entrapment syndrome that's going on, ligamentum pain, MCL, LCL, AC, ulnar collateral ligament, that kind of stuff. Also, reduction in edema, it's very helpful with that, as well as scar tissue adhesions, post-surgical or a traumatic scar. So contraindications to Graston technique, there's absolute, which means you can absolutely not do it, and there's relative, where it's an individual base-by-base decision. So absolute would be anything like open wounds, unhealed sutures, that type of stuff, thrombophlebitis, uncontrolled hypertension, inflammatory conditions, contagious or infection skin conditions, hematomas, osteomyelitis, or unstable fractures. Relative contraindication would be something like cancer, burn scars, kidney dysfunction, pregnancy, certain medications, rheumatoid arthritis, varicose veins, lymphedema, RSD, polyneuropathies, and unhealed or non-complicated fractures. So any condition contraindicated for soft tissue mobilization is usually contraindicated for Graston technique as well. So this is my first tool. This is GT1. It is long. We kind of call it the handlebars here. It's a single bevel concave treatment edge with 2 convex knobs. So it's applied to large muscle groups and is used for scanning and treatment. It's especially good for large muscle groups such as upper trapezius, latissimus dorsi, paraspinals, quadriceps, hamstrings, and the gastrocs. This is GT2. It's a 1 single and 1 double bevel edge and 2 convex knobs on either side. So these are used in small muscle group areas. It's also used for scanning and treatment. It's especially good for things like the subacromial region, thenar, hypothenar eminence, around the malleoli, this patellar joint mobilization around the patella, and medial and lateral epicondylitis. This is GT3. I call it my popsicle stick. It's a single bevel convex treatment right here. So that's my treatment edge right there. And it's applied to a very specific location. I can really get into a small area with this tool. This is GT4, single bevel all along this top edge here. It's convex with a point at each end. It's usually used as my scanning device, and it's also used for treatment. This is GT5, single bevel concave edge. So this is my treatment edge at the bottom here this time. It's applied for scanning and also a more aggressive treatment because it can get really good contact with the skin. And this is GT6, the little guy. It's 1 single and 1 double bevel edge. We also have this little hook here and a nice tip to use. It's applied to smaller regions, very localized direct contact. This is the emollient I use, kind of smells similar to a cocoa butter, just gives me some area so there's not too much friction with the skin so I can get my job done. So the procedure for Graston, there's soft tissue warm-up, cardiovascular work, bike, treadmill, that kind of stuff, ultrasound, paraffin wax, hot moist packs, all that type of stuff to get the body warmed up for it. Then we use the Graston technique to that specific area, and then we finish with stretching of those muscles that we treated, and some rehabilitative exercises, high rep, low load, and then cryotherapy, which is ice. So this is a typical patient progression. The first session is going to be soft tissue evaluation, gentle treatment to gauge the patient's response. I need to see how you respond a couple hours after your first treatment to see how you tolerate. The second session, we're going to implement the Graston technique, including stretching and strengthening. Third session through discharge is we're going to modify the technique, maximize response, improve functional levels. And potential treatment response is going to be pain and discomfort, petechiae, bruising, spontaneous connective tissue release, whereas we just actually get to an area and it does release, giving people a lot of relief, but it may feel a little weird when it happens. So connective tissue types that we have, there is dense regular with ligaments and tendons, dense irregular, which is aponeurosis, joint capsules, periosteum, the dermis of the skin, and fascial sheaths. There's also loose irregular, which is superficial fascia, nerve and muscle sheaths, and internal organ sheaths. So the components of the connective tissue, there's collagen, the 4 types, elastin, the glycosaminoglycans, and water. So what are the benefits of the soft tissue mobilization? There's release of fascial restrictions and adhesions. It separates and breaks down cross links, splays and stretches connective tissue and muscle fibers, increases skin temperature, facilitates reflex changes in muscle and tone, alters spinal reflex activity, increased amount of rate of blood flow to and from that area. It increases cellular activity in the region, including fibroblasts and mast cells, and increased histamine response secondary to mast cell activity. So factors affecting treatment, there's basically the stages of the condition. Are you acute or are you chronic? Acute, we're going to treat, control the edema, increase range of motion, decrease pain. I'm going to use certain GT instruments that help with your specific condition, and we're going to put tissue in the appropriate position to work on that. For chronic, it's actually mechanically disrupt the fibrotic tissue to increase that range of motion, decrease pain, and we're going to create new fibroblasts. So we're going to also select the appropriate tool for your condition, and we're going to place that tissue on stretch with a little bit of resistance to it. Thank you. Feel free to call me with any questions you have regarding Graston technique or any other techniques that I use here. Have a great day.